Hey everyone, I'm Maria. Thank you for tuning in to Chasing Nurse Riri. No, I'm kind of all messed up right now, but man, I am like over the top with so much stuff to do, and sometimes I gotta kind of like fit things in between time. Doing something to my face. Skincare is like amazing, so we have to make sure that we implement that as well as trying to chase this nursing degree, right? In addition to eating, so I'm glad I wasn't eating right now. But anywho, got a few things that I did want to talk about. I was going to wait to tomorrow to do my video, but I definitely changed my mind. I do have to study for this exam, so that's why this video is going to be a little quick. But I had a few things, especially I need to get off my chest. This class, this pediatric class, is driving me insane. Yeah, really is. I am not engaged. I am so bored. It's too much. It's so much information, and it's just like, I don't know how to relate it, I can do the milestones and relate it to like that part, the growth motor skills and fine motor skills. I can do that part. I can even do the immunizations, like gathering that together. I found a lot of different techniques to kind of help me with the immunization part, and I do want to share one because it was really interesting. I thought it was really cool how it was set up. I wish I could remember where I got it from. But I'm gonna do better in the future with that. I really am, I promise you. So it was this guy that's on YouTube. He had it set up like this, and it pretty much had like the legend over here where it had the hepatitis B, the DTaP, rotavirus, the HIV, the polio, I think that's pneumococcal right there, MMR, hepatitis A, the varicella, the Tdap, HPV, and meningococcal, which is meningitis. So he had it listed how in each column it just had B, birth right there. That's only get one, so that's hepatitis B. And then this was B, Dr. Hip. Yeah, B, Dr. Hip is how he had it, and that just lets you know which ones were needed. Like that's the second hepatitis B, and then that was the DTaP and rotavirus, and which one is that one? Oh, that's HIV for the hip right there, and then the polio, and then also the pneumo vaccine right there. So I thought it was pretty cool how he had these things kind of set up here. So also I like how he put in the IN just for influenza, just implementing that at 6 months. So 6 months continue to lifetime is pretty much when you would put in your influenza. So some things I got from this was really helpful for me. I know everyone learned things a little different. So the actual analogy he used for that was be Dr. Hip in 6 months. So that's how he kind of remembered it. So it kind of worked out for me instead of just writing it down. Some of the other stuff, immunizations he had from like 1 to 5. Oh, I love the 1 to 5 one. It's mad HPV. So that was really cute. Kind of helps you understand what was needed, like the MMR, hepatitis A. I think that's DTaP, right? Yeah. And then HPV. Let me see. And then then the HPV was on there as well. So it was really helpful. I guess everything just works for certain people. So it was kind of helpful. I wrote it out. I wrote another one out too, so I'm trying to go back and forth and figure out which ones that will work for me. So I kind of like, memorize the things. It definitely helps me out a lot with that. So that is pretty helpful. Did one event, yes, Tuesday. I had a quiz. Oh my God. The quiz was not easy and it wasn't difficult either. It's just with nursing school, the way they word the testing, it's a little frustrating sometimes. And I guess also because I like to overthink things. I don't ever see, sometimes I don't ever see a simple answer. And if I don't see an answer that's either select yes or no, sometimes I'm kind of going back and forth with myself, it might be this, Maria, or maybe this. But if it's yes or no, then I'm more okay, I understand that. I don't know why my brain works like that, but it just does. So it was 25 points. I got 24 out of 25. So of course I tried to question the one I got wrong, which I understand why I got it wrong. But I was explaining the wording of the question made me think a little different. So the question was, which vaccination prevents against pertussis? Now, I put DTaP in children because that's what it is. Put children in parentheses, in children. School age kids, children, babies, all that good stuff, because we're in peds. But during the lecture, it's also a part that's in there, not just from me being out in the medical field, but in the lecture, the notes, it also states that parents and grandparents can get a Tdap to also prevent pertussis as a booster, which I understand that. I totally understand it. So the way she was explaining it to me was you have to have the DTaP first in order to even get the Tdap. I understand that. But my point of the matter was they both prevent pertussis, right? So when it asks which vaccination prevents it, I put DTaP in children and adults, such as parents and grandparents, can get a Tdap as a booster to prevent pertussis. And I got it wrong. I understand the point that it was just strictly supposed to be DTaP. But my thought process wasn't working like that. So, anywho, I got a 24 out of 25. I'm going to go ahead and let that ride. Next time, I just have to remember that I have to go through and answer the question just as it is. Don't add extra information. I had this same situation happen to me in Mother Baby. We had a question about a non-stress test, hooking a pregnant mother up, monitoring the baby, specifically just to check on the baby's well-being. So when it asked what was a non-stress test, an NST, I put, what it was used for, I put to check on the well-being of the baby. And of course, you can move forward to what is it? A contraction stress test to see if the baby can withstand labor. So granted, I talked my way into that one. So I talked my way out of it. I pretty much got it right because she understood where I was coming from. But she also told me at that time, Maria, you have to stop, put more information on there. You have to just answer the question as it is. And I don't know if it's because I'm an Aquarius. I'm always thinking. My mind is constantly going. I'm always trying to rationalize and put things together and make things make sense, that I write like that and I think like that. So I take exams like that. So I have to start to just put the information in place that needs to be in place, period. So the answer was DTaP and not DTaP and a Tdap as they get older as a booster. Although that is what happens, was not the answer that she was looking for. So that's that. Overall excited right now because, of course, I have good consistent grades right now. But I have this exam tomorrow, and the class itself, it felt like it's a class that I could have taken online and just read the information and studied from that. Because I'm not fully engaged in the class, it has nothing to do with me not liking peds. I just think the way the class is structured, the information is not sticking for me. I can't relate it. I have kids, but I can't relate the information to tie it together to say, oh, this is this. Oh, this is this. Oh, I remember seeing this. So that goes back to my last video where I said maybe when I get out there to the clinical setting, maybe it will be a little bit more different. And maybe I'll be able to relate the things together, tie them together, and they actually stick. Because right now, I don't know if I need some Adderall, some Vyvanse, lorazepam. I don't know what I need, but I need something to bring this information together and make it stick, because I not only need to pass this class, but I need to be successful in this class. I need to understand. I don't see a future in peds, but I do want to be a well-rounded nurse and know all fields. Not necessarily be an expert in everything, especially if I don't work in it, but I want to know the information. So if someone asks me a question, I'm like, oh, okay, cool. With bacterial meningitis, of course, that is a droplet precaution. I want to be able to relate that information, understand it, and be able to talk to someone and hold a conversation to another medical professional about pediatrics. So that is that. So yeah, like I said, I do have to study for this exam tomorrow. It's on a few chapters that we have. So it has been a lot of information with that. I had a simulation today. We did awesome. We did absolutely awesome. I worked with 3 of my other classmates, and they were truly amazing. They were lifesavers, because with pediatrics, that is not my strong suit. And when you go into these simulations, no, they don't expect you to know everything per se, but they expect you to have some type of idea. So me being an assessment nurse, okay, of course, I don't know if you guys ever know about simulation, but they put you in this room, they give you a case study on a patient. Whatever is wrong with this patient or whatever is going on, this is what you have. So we had this patient, and let me get my notes for this one. All right, so we had this 6-year-old Caucasian little boy. His name was Cooper Madison. This stuff is online, so you can get it there. He went to ER. He had a closed head injury, concussion. He fell from a treehouse. He had a CT scan, and it was a questionable skull fracture and subdermal hematoma. So I'm thinking to myself, okay, subdermal hematoma, okay, of course, maybe, increased ICP, intracranial pressure. So I'm thinking of all these things. He was having a seizure, didn't have any spinal injuries or spinal fractures, so he wasn't paralyzed, he can talk, all that good stuff, can move. So I'm an assessment nurse. We have someone else that's a medication nurse who's going to be administering the medications. We also have a documentation nurse. So when she go in there, she write everything down on the board. And then we have a charge nurse who's pretty much in charge of everything, trying to make sure that everything runs smooth. So in my head, I'm putting together different things. I'm like, okay, this is a school-age boy. He's probably about the 1st grade. So I'm thinking of all these things before we go in there. So I'm thinking about the different type of seizures, what happened through the different phases. And I promise you, learning those 3 different phases actually really did help me. Because when I got in there, it was rough. Because I've never dealt with a child having a seizure, especially in the simulation. So it was kind of awkward. It was kind of different. And then plus one of the sim lab instructors played the parent, so she was the mother. So she was asking me questions, and in the midst of all this, I'm like, okay, Maria, stay calm, because this baby is seasoned over here. You don't know what the heck is going on. Stay calm. So I had to keep reminding myself to stay calm. So I just was thinking about a lot of things, dealing with seizures. I know, like in the hospitals, when we did the med-surg rotation, and we had to do like, we'd go into the room and on the door or something like that, it would say seizure precautions. So of course I know that's the bed rails are padded, things like that. So I was kind of familiar with those type of things. So when we got into the room, we were able to look around and see those things just to make sure that they were in place. Of course, I already knew, like, if, the patient have a seizure, turn them on their side, move the surrounding items, because they don't want to injure themselves, things like that. So I was just thinking a lot of things in my head. Like I said, I'm one of those people that just think everything in their head, try to put things together. So I was thinking what possible medications, before we even got in there, what possible medications this patient can get. I was thinking like sedatives, like lorazepam, diazepam. I was thinking anticonvulsant agents. I had a lot of things that I was theories in my head. I just wanted to make sure that we maintained a clear airway. That was one of my main focuses. So when we got into the room, my initial thought, okay, of course we do aided. We make sure that we verify the information, not verify, but introduce ourselves first. And then, of course, since I'm the assessment nurse, I go over there, I check the wristband and ask about allergies. So I asked Mom if she can verify the patient's date of birth and name for me. And Mom was like, oh, well, he can talk, he can verify his own information for you. And not being a peace person, like working in the peace field, it was kind of difficult for me to kind of get to that level to have that conversation, because this baby is sick, he's not feeling well, and I want him to answer my questions. I don't want to rush him because I'm very patient. It's just a matter of me trying to figure out how to get him to answer the questions. So I'm like, oh, hey, how are you? So are you Cooper? Yes, my name is Cooper. Okay, Cooper, tell me your date of birth. Yes, exactly how it was. My what? Date of birth. Day you were born. Day you celebrate your birthday. When were you born? Like, I'm just trying to figure out a way to kind of ask him his date of birth. And he couldn't give me that information. So I kind of like moved on, like, okay, Mom, I know he's in a lot of pain or whatever. Can you just verify his date of birth for me so I can move on? Like, this is a simulation. I don't have all day. Please forgive me. I was not trying to rush the situation, but I just needed to get the information that I need to get so I can do my assessment. So with that, I was able to take my vitals. So I got my vitals, and then immediately O2 stats just dropped. I couldn't even do a full-blown assessment, couldn't even assess his head, couldn't even do my glaucoma scale, couldn't even do any of that because he just went into a seizure. So I'm like, oh my God. So we turned him over to the side, and we're talking to him. Cooper, are you with us? All right, he's seasoned. We're trying to figure out how long the seizure is and make sure everything's surrounding. Calm Mom down. That's the number one thing I'm trying to do too, because Mom is like really over there on 12, which I truly understand, because I probably would be on 12 too. But I'm like, Mom, calm down. We all have to remain calm. Everyone has to remain calm, because that's the only way we're going to be able to successfully get through this. All right, so got him on the side. He's already having his nausea, vomiting, everything. So we were able to successfully get him to come through that seizure. We were able to call a doctor, get some medications for him. I think we got like some lorazepam, something like that for him or whatever. And we had another person that was taking care of that. We pretty much wrote out everything. We were not trying to like go through and figure out like, oh my God, do the shortcut of that dimensional analysis. We were trying to seriously go through, because this is a child. This is our first time dealing with, pediatrics. So we want to make sure that we give them the right dosage. We know that can be really tragic. So we were going through making sure everything was set. We had 3 nurses that double checked the medication and make sure that we did everything right. So in the meantime, I'm calming mom down, using that therapeutic communication that they teach you, and I just totally didn't even do my assessment. I checked vitals. I did check his lung sounds, things like that, but that full-blown assessment, I couldn't do because I'm trying to comfort her, and I'm trying to comfort this patient, make sure he stays on his side, and then when he finally came through, told you guys about learning the 3 stages of the seizure. He pretty much was like, Mom, I saw ice cream sandwiches and you were an ice cream sandwich, and just saying all this crazy stuff. But that does tell you at the end of the seizure, at the end of it, when you actually come from it, you kind of are delusional, confused a little bit. So those things tend to happen. So I knew what was going on. So when Mom asked me, I was like, oh, pretty much, the seizure is over. This is the ending part. He's pretty much much coming to. And these are things that can happen. It is normal. So I was able to have that conversation with her. So that really did help me out a lot. I really did enjoy Sam because of that, because I was able to understand that part of it. But I know that I do have to work a little bit harder with as far as trying to engage with kids and talk to kids, because I'm just used to talking to my own and doing sports physicals and stuff like that, not really having experience with kids at the bedside. So I guess that's what this class is trying to help me understand how to do. But I think I more so need to be in a clinical setting in a hospital, which would be my clinical time, so I can learn how to interact and how to address them and how to talk to them and how to gain those skills that I need. Yep, so that was that. So we absolutely aced that. Had some other stuff in sim lab today, learning some more NG tube stuff that we learned previously. Just brushing up on our skills, stuff like that. So it was pretty cool. So yeah, that was that. So tomorrow I do have an exam. So what I will do is let you guys know how I did. So I will post tomorrow after my exam. Hopefully it's going to be good, and hopefully she will release those scores tomorrow, so I can do that. If she does not release the scores tomorrow, then I make a post on Friday just saying what I got, how the test was I stressed out like I am now, trying to figure everything out between work and all that. I would probably have to do that post from work because I work on Fridays. So yeah. And then, of course, as always, I tell you guys, you can always leave questions. Give me your information. Let me know what you guys are doing, how things are helping you. What can help me in the pediatrics? What can help me? That is what I need to know. I would like for someone to tell me what can help me in pediatrics, because it is driving me crazy. And if someone can tell me what can help me further engage into it, I would be so appreciative. I really would be. You have no idea. So anyways, oh yeah. So I did get this book here. This is the ATI book for pediatric nursing. It is amazing. It has so many things in here that will definitely help you. It goes through so much of the stuff. It's almost like her questions and stuff that she does in class kind of come directly from here. A lot of our information we pull from here, and also the textbook as well. I don't have the textbook. I'm running low on funds because a lot of my classes now I have to pay out of pocket. So things like this I can get. Definitely utilize Amazon. I have Amazon Prime. This book new is like $25. I got it for $10 because I got it used. So I know last session I was telling people that now you can, I don't know if it's been a thing or not, but I just found it out that you can actually rent the books. Oh my God, amazing. Like when I had pharmacology, I rented the pharmacology book for the whole session for $25. The book was $125. I just rented it for $25. So Amazon Prime is the best thing ever. Like if my classes are Tuesday, Thursday, so if my class start on Tuesday, I may not have that book on Tuesday. I may have it by Thursday. So either way, I normally get everything in 2 days, so I'm pretty good with like the study material and things like that. But definitely let me know if it's some things that help you, because if it is, and you can let me know, then that may make my life so much easier. And I would love that, because that would definitely help me become a better nurse. So until Friday, guys, or tomorrow, I don't know, whichever one comes first. If whatever one's my grade is posted, I definitely will let you guys know. I don't care if it's a bad grade or a good grade. Hopefully it's a good one. I will definitely hop on here and let y'all know. Okay? All right, until next time, thank you for joining me. I am Maria, and this is Chasing Nurse Riri. Bye-bye.